Okay, everyone, thank you for your patience while we switch gears a little bit here on the program. It doesn't seem possible, actually, that it is only 15 months. I was, similar to Colleen, was thinking the same thing. How long have we actually been talking DSRIP, and how long has it been on the horizon? And while the truth of the matter is that it has only been 15 months, it feels so much longer than that. But I am certainly glad to be here. And show of hands, who else is happy to be here today? Oh, lots of hands. Lots of hands didn't go up, and that wasn't a trick question. The answer is yes, I am ecstatic to be here today because we have been talking about DSRIP. We have been hearing about it for well over a year now, and while it feels as though we should be with our sleeves up and ready to dig in, there was so much work that has needed to be done up until this point in time that has really brought us here today that Colleen and Kathy have certainly alluded to, with all of the governance pieces that needed to be formalized, a lot of the structures and infrastructure that need to be put in place, and then also a lot of the planning for the planning, if you will, because it is in a constant state of planning for the next while simultaneously implementing and executing, which in and of itself presents multiple challenges. But nevertheless, it is certainly a great day to be here in the Adirondacks, of course. Perfect leaf peeping season for the write-up. And also because we are in the midst of very, very exciting times with this point in healthcare history. Jason Helgerson has some little spoof on the DSRIP letters, and I'm a terrible joke teller, so I can't actually repeat them all in the right order, but I do know that he has S, he has a little spoof for suffering, and P, he has a little spoof for pain. So amidst and aside from the pain and suffering that the DSRIP is posing, pretty much in jest, it does present us with a tremendous opportunity to actually change and define the way in which our communities will access and obtain their health care going forward. And if you think about healthcare over the past 20 plus years or so, I'm scanning the room and I see a good portion of the room that are probably where I am, midpoint in the 45-year plan. And I see another good portion of the room that's a little closer to being to the end of the 45-year plan. But if you think back, at least even on my 20 years of professional experience, working a few years for a payer, and then also most recently for about 19 years in health policy and education, we've had all sorts of things. Of course, from government-driven, we've had HSAs, we've had HEAL, we've had several versions of NIFERM, we had BBA, affordable care. All of those things have had an impact on how healthcare is delivered to our communities. Again, with them being government-driven, there isn't certainly much room for creativity. So really, for the first time, if you stop and think about it, we've been empowered to actually create the system in which we are going to work collectively, by which all of our community members are going to have their health care needs met. And that's pretty important when you think about it. I mean, I'm not a clinician. I'll never be able to go home at the end of the day and say, oh, I saved a life today, or I changed somebody's health, or I gave somebody health. But to be able to be the catalyst and be a part of a larger group of people who are all working together for the same common goal really is powerful. And I think at the end, when the DSRIP 5 years are over, and it will end, it will become a different DSRIP, it'll be DSRIP to the second degree or whatever, there will be something after it. But I think when it ends, we will certainly be able to have a tremendous amount of pride in the amount and degree of accomplishment and change we had in meeting the healthcare needs and and making our communities just better overall, healthier overall. So I think that's something that we all have to look forward to as we embark on this very long journey, this 5-year journey to reach the DSRIP goals and the DSRIP achievements that will ultimately bring us to a better place. So one of the other reasons why I'm delighted to be here today, I actually joined AHI a couple months ago, so I'm glad to have had the opportunity to join the organization and be here with all of you today and start this project at a very pivotal point in time. There has certainly been a lot of work that's been done heretofore, but we're also just beginning with the implementation plan that was loaded on August 7th specifically. We're really at a point of rock and roll, if you will, to really get this in motion. But it's a privilege to be here, and I have the distinct pleasure of, in a minute, introducing to you your project management office, who, if you've had a chance to look through one of the sheets in your packet, list each one of them out individually and really illustrates the recruitment effort that the AHI leadership has put in place to bring on board a very accomplished, educated, and enthusiastic group of individuals who are very able, willing, and thirsty, really hungry to really get into all of these projects and work collectively as a team, but also again, with all of you as we start to roll out the project team kickoff meetings, which some of them will refer to, and also all of the team activity that will start to go after all of those tasks that are included in all of those milestones that are included in all of those projects and organizational components that Colleen just referenced. But before I introduce the Project Management Office, I do want to take a couple minutes to introduce some other very important people who are kind of the men and women behind the curtain, if you will, the Oz, back at 101 Ridge Street. And I want to make sure I don't forget anyone, so I'm actually going to just refer to my notes to make sure I don't overlook anything. So first is Leanne Bradley, who you might have met out at the registration table. She is our Health System Transformation Administrative Support Person. You have probably had the benefit of hearing her lovely voice on the other end of the phone when you call our offices. But she's in our HST division and responds to many of the issues of the day that are changing by the hour and sometimes by the minute. Second person I'd like to recognize and thank for a lot of the effort that went into today's meeting is Phil Kahn, who's our roaming photographer. Phil works in our communications department and was very busy this past week or so helping with the materials preparation for today's meeting. I probably drove him nuts more than once over the course of the week, but he was always responsive with a can-do attitude and a sure thing, no problem, you got it. So I'd like to thank Phil for his contributions today and also bring to light that after today, we will be revealing, not so much revealing, but we will begin a comprehensive communications strategy plan with all of our partners. We recognize that as we've been planning and we've been attending meetings and attending conference calls and such with the state over the past year or so, there's been some gaps because of resources and the time in which information is provided to us to in turn to provide to you. But we recognize that communication is critical to the success of these 11 projects and work streams, organizational components. So we've been, over the last couple months, planning and devising a communication strategy that will include print and electronic communication as well, to basically keep you and all of your subcontractors that you will engage with as well, really up to date with all of the activities that are going on with the DSRIP projects and all of the team activity, all of the minutes, basically a repository for all activity related to the projects that we need to be sure you're aware of and that you also want to be kept abreast of to to maintain your level of engagement and your level of familiarity with where we are and how we're performing, which is the other key piece. And third is Claudia Higgins. Claudia is probably floating around the back as well. I do want to thank her for her efforts this week. She's been my indispensable right hand. She's done it all. She's tended to every meeting detail. She's dotted every I, crossed every T. And while one thank you certainly doesn't feel like enough for Claudia today, I'll thank her 100 times over, but certainly the success of today's event has been due in a large part to her efforts as well. And Dan McGovern was another person that you saw rolling around on the slides. Oh, Dan. Thanks, Dan. I'm just looking aimlessly, but I know you're out there somewhere. Dan has been the DSRIP consultant with AHI for the past year and a half or so. He's been a fixture to some degree in the building during that course of time, being involved with a number of activity and tasks that were necessary to get us to application stage and also to implementation stage, which is where we are today. Most recently, he has been handing off a lot of his pieces to various members of the project management office as they've been coming on board, and so consistent with the role of a consultant, he has basically positioned us to be able to walk on our own, which is about where we are right now, and so he is going to be handing off some of his projects to some of the new people who have onboarded, and most particularly our DSRIP tracker tool, which is a product of Performance Logic, which is something you will be hearing a lot about in the not so short term. It is a tool that the AHI leadership spent a lot of time researching and investigating before actually investing planning grant money to bring into the AHI organization. That tool is, in addition to its project management function, will also be the repository for all of the data collection and reporting measures that all of the partners will need to be doing over the next several years to mark our progress in meeting the deliverables, and also, of course, the result being the compensation that goes along with those in reaching our achievement values. So he has been an integral part of the Performance Logic DSRIP tracker tool, the development and the bringing of it inside AHI, and the training for other staff as well, and most particularly the next person I'll mention, who is Deborah Larose, who you saw in the picture or in the rolling slides. She will not be sharing any projects with you in the next few minutes. Deborah is kind of floating over all of the projects within the PPS. She will be managing the project performance and has quickly become, in her 2 weeks since she's joined the organization, our resident expert, if you will, with our DSRIP tracker under Dan's guidance. So we thank Dan for all of that he has done to bring us to this position that we're in. We feel very comfortable with where we are and where we are going. Not solo, of course, only with all of you. So I think I covered everyone that has had an integral role in today's success. So I am going to now turn the next half hour or so over to our lineup of project managers who have oversight for all of the projects that Colleen just referenced. If you want to follow along, and for easy reference after you leave here today, there is a very robust DSRIP packet in your left-hand pocket of your folders. It provides you with a project overview of each of the projects that the AHI has selected to engage in, as well as the accompanying milestones that we're responsible for within each of those projects. So they're going to provide you a little insight to them. I also wanted to use this opportunity to give you the opportunity to put a name with a face. Their contact information is on all those sheets, but they are a group of individuals who will be out in the boots on the street, so to speak, with all of the projects. So I wanted you to be able to at least be able to put a name to the face or a face to the name, and to give them an opportunity to share with you just a little bit about why these projects have been selected by AHI, a little bit about kind of the meat and potatoes and nuts and bolts of the project, and then also in some of the instances what some of our activity is heretofore with them. So first person I will introduce and turn over the podium to will be Paula Jacobson.
Okay. Thank you for the introduction, Rachel. I'm here to tell you about Project 2AI and 2A4. So I'll begin with 2AI. Project 2AI is a system-wide project that encompasses creating an integrated delivery system, which is to ultimately achieve the goal of DSRIP, which is to reduce avoidable hospital use by 25%. To achieve Project 2AI, the healthcare delivery system will need to transform from an institutionally based approach to a community-based care approach, with emphasis on evidence-based medicine, specifically behavioral health and substance abuse, post-acute care, and long-term care. There are several core components to 2AI, which include governance, regular and comprehensive community needs assessment, and patient-centered medical home recognition. First, the governance structure was developed that incorporates a balanced representation of sector and geography. Second, when matching the community needs assessment and DSRIP goals, the PPS selected 11 projects to achieve the integrated delivery system. To ensure that we meet the goals of the project, we will conduct ongoing monitoring and evaluation of the community needs assessment. Third, a key component to reducing avoidable hospital use can be achieved through evidence-based medicine and population health management. Based on our community needs assessment, the project aims to expand access to high-quality primary care through patient-centered medical home recognition. The second project that aims to achieve evidence-based medicine and population health management is Project 2A4 Medical Village. The objective of this project is to reduce excess bed capacity and repurpose space for integrated outpatient services, providing emergency, urgent care, and outpatient medicine. This project is an opportunity to utilize existing infrastructure to realign health system capacity and support the behavioral health, substance abuse, and outpatient services needed in the community. Currently, we have 4 implementations developed for Medical Village. All of the organizations applied for the New York State Department of Health capital funding, and there has not been any announcement regarding the awards, as Colleen mentioned earlier. Therefore, the project status is on hold until we hear about the funding. A Medical Village partner conference call has been scheduled to discuss any status reports for October 21st. The next project to be presented by Ruth Ann Craven is Project 2A2, which encompasses the details required to become a patient-centered medical home, which is a prerequisite for a number of DSRIP projects involving primary care. Thank you.
So as Paula mentioned, Project 2AI relates to the primary care providers in our network. And there's a great deal of overlap between this project and the project related to the integrated delivery system, the Medical Village, as well as integrating primary care with behavioral health. So our objective is to transform all primary care practices into NCQA patient-centered medical home at a level 3 under the 2014 standards by the end of DSRIP year 3, which is March 31st of 2018. Participating practices and their providers are expected to meet PCMH standards as well as attest to meaningful use stage 2 and effectively sustain this model throughout the DSRIP project. AHI will be providing guidance and support in managing the project along with an administrative representative and a physician champion from each primary care practice. In your handouts, there's a DSRIP project fact sheet packet. The Project 2A2 summary that you have in that packet outlines the 9 requirements for the project. These requirements, referred to as milestones, have been set by the Department of Health. So in addition to patient-centered medical home recognition and attesting to meaningful use, there's also milestones related to population health management, including evidence-based preventive care and chronic disease management, as well as implementing preventive care screenings. The project is expecting all Medicaid members, patients, to be brought in for an annual visit and to have care plans developed. And with those visits also be screened for depression and behavioral health needs. And also doing the connectivity with the RIOs and HCSCN for information exchange. An AHI transformation coach will be contacting each primary care practice to conduct an assessment to see where you are at the current state and what needs to be done in order to accomplish these milestones. And if needed, transformation coaches are available to provide training and education on patient-centered medical home standards, meaningful use standards, supporting the practice in addressing any gaps that were identified during the assessment, and assist the practices in developing work plans and a timeline so the NCQA documentation can be gathered and submitted in a timely manner. Transformation coaches are also available to help with PCMH-focused policy and procedure development. So as many of you know, with the 2014 standards that NCQA has set, there's a big focus on integrating primary care with behavioral health. And Heather Bradley will talk about the next project, which addresses that.
So behavioral health primary care integration is one of the partners sitting in the audience told me has the ability to transform our ER utilizations. Many individuals struggle with not only diagnosable mental health needs, but also behavioral health needs related to general medical conditions such as diabetes. By providing more inclusive care in a setting that an individual finds themselves most comfortable, there's the opportunity to increase effectiveness of treatment and also provide access to services previously not available. Specific activity updates, I've had the privilege of working with providers from Warren, Washington, and Saratoga County who've been discussing referral criterias, access to services, tossing out different models of care ideas. Knowing that we have challenges in our region with capacity for behavioral health providers, this project is a big undertaking, and I'm excited to be on that journey with you. We also, AHI held a meeting with Cherokee Health from Tennessee, where they did a one-day overview and talked about their integrated model of care. And another project that I'll be working on with you is Project 4A3, Mental, Emotional, and Behavioral Health Promotion. As we move toward treating individuals as whole persons, there's the need to promote MEB wellness. Looking at trauma and generational poverty are just two of the projects that this is going to be undertaking to promote wellness. The PPS has a PPS-wide coalition comprised of prevention leaders. We have CSB directors, clinical representatives also, and they met twice in the first quarter and looked at the implementation plan as well as have looked over job descriptions for who will be executing the different training components of this project. And they will continue to meet quarterly to work to meet our objectives. Mental health is a huge arena, and I have the distinct honor of introducing Jill Rock to you, who's going to talk about 2 mental health projects in addition to another prevention initiative.